I think in the UK we're in a pretty leading position actually internationally for the use of AML. So our main trial for younger adults uses MRD to select patients for intensified therapy and for transplant. And we also use MRD for follow-up to identify patients who are relapsing long before they become ill, so that then they can go into the next stage of their treatment in a very good state of health. And we're currently performing a study where patients are randomised between being monitored and not monitored to try and quantify the benefit and see if that improves patients' chances of survival. The MyeChild01 study is an international Phase III study for children with AML. AML is relatively rare in children. There's about 100 cases per year in the UK, so that's why we needed to develop a collaborative international trial. The outcomes are significantly worse than for children with other types of leukemia. ALL is the most common type of leukemia in children. They have approximately 90% cure rate, whereas children with AML have only about 50% chance of being cured. And the MyeChild trial is very innovative in that it uses MRD at certain key milestones to choose patients to intensify their treatment and to select which patients are going to undergo transplant. Transplant in children is a big undertaking because it has significant effects on development, on fertility, and can cause a whole range of unpleasant complications. So it's really critically important to be able to choose patients who really need it. And the remaining children who have a favourable MRD response are treated with consolidation chemotherapy, which will have much fewer long-term side effects and hopefully lead to significantly improved long-term outcomes. And in that study we're also collecting further samples at various time points from these children to try and define new MRD markers that could be useful for children in the future for the next generation of trials. The AML19 study is a large national study for younger adults with AML up to the age of 65. We've currently recruited over 2,000 patients. And in that study, MRD is used as a kind of key decision point to choose which patients will undergo transplant. We're also collecting data on quality of life, health economics and resource use, and seeing if MRD techniques can actually be used to improve the efficiency of treatment and the quality of life of patients as they undergo therapy.